Shifting focus away from the Middle East, back to the coronavirus outbreak, where there's a briefing at the presidential palace in Philippines' capital, Manila, on the virus outbreak. Let's quickly listen in.
And that is now being investigated by the Epidemiology Bureau.
Okay, thank you po.
Okay, Mikael? Microphone, please. Alvin, paabot ng mic.
Hi, good morning, Dr. Carlos. Mikael Flores of AFP News Agency. Ma'am, just to clarify on the timeline of the 2 confirmed cases, because DOH announced the first confirmed case on January 31, and then the first mortality was announced yesterday. Why was there a 2-day gap between the confirmation of the cases? When did you actually confirm that the second confirmed case is nCoV? Because it turns out that the two are a couple from Wuhan. So why were they not tested at the same time?
The sample from the first confirmed case was sent to Australia, and the sample from the second case was, although sent just last Friday, we had the results done. We had the testing done already at RITM by the time. So the official results from the second case was sent out last Saturday morning only. So the results of the first confirmed case came earlier because that was sent to Australia.
Ma'am, just to clarify, the second confirmed case was confirmed already by our RITM because we have the capability already.
Yes.
Ma'am, why did the government not send both samples to Australia? Why did you just decide to send the sample of the first case?
We sent actually the sample to Australia of the second case last Friday, and we're waiting for the results, which may probably come anytime soon. So since we had the capability already for testing Thursday last week, we decided, of course, to process the sample of the other PUIs sent to us, and we had that result. And just to make sure that perhaps we were doing the right thing, we also processed in parallel the sample from the first confirmed case, which was positive, and we had the same results. So the staff was confident that our procedure was correct.
Ma'am, can you give us an update of I think we have around 36 POIs and 4 are undergoing testing. Can you give us an update if the 4 remaining cases have turned out to be positive or negative, and do we have additional POIs as of today?
I don't know about the additional PUIs because that's within the database of the Epi Bureau. The question should probably be answered by the Epi Bureau people. But as to the rest, so far with the results sent to me for approval, there has been no positive results to date.
Ma'am, why did you
after the second positive?
Ma'am, just to clarify, you already knew on Saturday that there's a second confirmed case. Mm-hmm. Ma'am, why did you decide not to announce that on Saturday, and why did you announce it just yesterday?
Well, we sent the results to our superiors, and it was the decision above which, it was them who decided when to call for the announcement. But that was late Saturday already, so perhaps there was not enough time to gather people to make the announcement on the same day.
Ma'am, around what time did was the patient pronounced dead, and was the confirmation before the patient died or after the patient expired?
The confirmation came before.
Came before. Ma'am, around what time namatay yung pasyente? If you
I am not aware of the exact time of death. But it was Saturday.
To Ms. Dana, can you clarify on the Chinese who are currently in NAIA? Where did they come from, and where exactly in NAIA are they currently held?
This is collectively, so they are not bunched up together in one terminal. So I would have to get the details kung saan sila galing, but most probably within the China and the Special Administrative Region. That's why they were caught in limbo and at the airports. But like I said earlier, the Chinese embassy has already coordinated this with our office and is planning to send special flights to fetch their nationals.
Okay, thank you, Mikael. Excuse me. Wait. Can we have Alvin Baltasar? Okay, it's a follow-up question. Yes, please. Please use the microphone, please.
Regarding the passengers stranded in the airports, I think it's not just Chinese is the biggest number,
Most-
but
yeah.
what would happen with the others? I
Most
think
of
there
them
are
were
some
a-
Americans.
Most of them were able to depart already.
So right now it's mainly Chinese,
Yes,
the ones
most of
stranded
the
there.
most of the ones who were stranded yesterday were able to depart already.
Okay, thank you. Alvin, then Chona.
Dr. Carlos, magandang good morning po. Doktora, here ma'am. Doktora, how can we assure the safety of the patients, pati yung mga health workers na naka-assign sa San Lazaro Hospital? Pati na doon sa mga ospital na kung saan mayroong mga patients under observation.
For San Lazaro and RITM, we have set standard procedures on infection prevention and control. And that covers a lot of things from the wearing of the personal protective equipment, to handling of patients, to cleaning of rooms occupied by infected patients, and so on. So both of the hospitals have a long history of handling emerging infectious diseases. And so far, we have been good. The health workers have been, none of them so far have been infected.
Doktora, dapat lang ba na magbigay tayo ng additional or recommend na magbigay ng additional hazard pay doon sa mga health workers na naka-assign sa mga patients?
Yeah, in addition to the previous answer, we also request our health workers to monitor their temperature twice a day. And then we quarantine them in case they develop any symptoms, and we manage the symptoms. Your question is about the hazard pay. I think
Additional, ma'am.
that would be good, but it's not within my power to determine whether that should be given. But if that is recommended, I'm sure all of us will welcome that, especially from RITM and San Lazaro.
Will you recommend, ma'am?
Of course.
Okay.
Although we have a standard hazard pay in government, but there are people who are exposed to more hazards than others, but they receive the same remuneration.
Thank you, Alvin.
Just a point of clarification regarding the earlier question about the 300 Chinese. The number does not just include those who are at the airports right now. It also includes the Chinese nationals who are in the country who want to go back to their homelands already. So it's not just the ones at the airports, but includes all those who are in the country who wants to go home now. I'm sorry? Not only in Manila.
Okay, thank you. Chona, ma'am, any update on efforts of the government to track down yung people who got contact dun sa one couple?
The Epidemiology Bureau staff have the updated information. I'm sorry, I don't have the updated information.
Okay. And ma'am, dun sa RITM, may mga test sample pa ba tayo na hinaantay from Melbourne, Australia?